I was told I would need radiotherapy after surgery, but the cancer had spread to my lymph nodes, so I needed chemotherapy in between. So I always knew radiotherapy was on the cards. It's something that kept me going through chemotherapy. I knew that this was the last little hurdle, so I was keen to get going as quick as I could. I think having survived and gone through chemotherapy, I knew that radiotherapy was going to be easier than that.
Radiotherapy is using high energy X-rays to try and get rid of any remaining cancer cells. Risk of breast cancer returning is halved thanks to doing radiotherapy after the surgery.
The decision to treat any patient is done jointly between the group, and that's the multidisciplinary team. That includes a group of surgeons, oncologists, radiologists and pathologists. Depending on your particular surgery and the findings at the time of the surgery, the pathology, we design a treatment program that's personalised to you based on the best evidence available.
We put all that together and come up with suggested pathway of treatment, which is a recommendation that then has to be tweaked or adjusted depending on your views and also on your other health issues, because nobody, it's not a question of one treatment fits everyone. We need to make this individualised for you.
When you come to the oncology clinic for the first time, you'll get to meet an oncologist. It's really important that the oncology doctor knows your full medical background because it may have an influence on the radiotherapy, and that you bring a list of all your medications with you so that the doctor can see that. They will explain to you what it involves, what the potential benefit is, which is reducing the risk of cancer coming back, and the possible short-term and long-term side effects. When you're happy with all of that, then together you and the oncology doctor will sign a consent form. We will fill in all the necessary paperwork. We will pass that on to our colleagues in radiotherapy scheduling, and one of them will give you a telephone call to let you know when you've got to come up for your preparation scan and to let you know when the treatment is going to begin.
When you first come in for your planning appointment, we'll talk about the planning process. We'll also go through the treatment appointments and what we do at treatment, and then we'll talk to you about the side effects that you may encounter while you're on treatment.
After your pre-planning appointment, you're given all of the appointments at once so that you can plan around them. I think it was 4 weeks for me because it had spread to my lymph nodes. You see an end date to it all as well.
After we've had a discussion, we take you into the CT room. We will ask you your name, date of birth and your address just to confirm that we've got the right person. We'll also take a photo ID of you, and this will be used as a positive way of identifying you whilst you're on treatment. There is a changing room in the corner where we will ask you to undress, and then we'll give you a little cover to cover you up while you walk to the bed. The whole planning scan usually takes between 10 and 15 minutes, and you don't feel anything at all. It shows us the insides of you in 3D, and we use that 3D imaging to actually place the radiotherapy beams so that we know exactly where the radiotherapy is going to go. We will be using what we call a breastboard, and that just allows us to position you correctly each day, because we record all the positioning of this board, which will be replicated when you have your treatment. We will leave you on your own, but we are watching you through the glass window, so if you need to talk to us, there's an intercom and we can hear you all the time. Sometimes for left-sided breast treatment, we ask patients to do a deep inspirational breath hold scan. We ask you to take a deep breath in and hold it for about 20 to 30 seconds so that the front of the chest wall is away from the heart. If we plan you with deep inspirational breath hold, then that will continue while you have treatment as well. If you struggle to do the deep inspirational breath hold, then what we do is we have a practice a few times, and if you don't manage it, then we just revert back to free breathing scan, and we use other methods to avoid your heart. Once the scan has been completed, we will put permanent marks on your front of your chest and on the sides of your chest, and these are tiny little pinprick tattoo marks.
I thought she'd scratched me, so I nearly went to swear at her. And then I said, "Oh, when are you doing the tattoos?" And she said, "I've already done them." So you really don't notice it at all. It's not particularly hard. It's to make sure that the machine is in the right place for you, because the breast cancer can be at any part of anybody's breast, so that they know that they're zapping the right bit, because you don't want to zap bits that don't need zapping.
We usually start your treatment within a couple of weeks. We've got the information that we need from the CT scan that you've had done, but then we need to actually do a custom-made plan.
From having the CT and having the dots put on ready to line you up was about 2 weeks from that appointment to the actual radiotherapy starting.